Good evening, everyone. I'm Lauren Cohn. After a staggering surge in violence and murders in 2016, the Chicago Police Department launched an aggressive campaign to hire 1,000 more police officers and diversify its workforce over the next 2 years. Nearly 500,000 Illinois residents depend on the Affordable Care Act, also known as Obamacare, for their health insurance. Republicans in Congress want to repeal and replace the law that also covers nearly 20 million Americans. And to learn more about our show, guests, and stories, log on to our website at WYCC.org and search for the link to In the Loop. And until next week, I'm Lauren Cohn. Have a good night. Joining us now are Nancy Hardy, reporter for WBBM News Radio 780 AM, attorney John Giocaris, and Andrew Fogarty, director for 36 Squared Business Incubator. Thank you for coming in. Appreciate it.
Thank you for having us.
President Trump calls it the worst trade deal in history. Nancy, do you agree? Christine, reaction to what the president said, because his theme of his speech was the state of democracy, and he talked about being a citizen, which is important because while he will be a citizen now, it seems to me that he may just be the hope for the Democratic Party to sort of reunite. You know, the city of Chicago and the fact that Charles brought up clout, I want to switch to Mayor Emanuel and his emails and the fact that some of them are out, and the Chicago Tribune did a great report on this, and now we have the Chicago Board of Ethics appointed by the mayor evaluating the emails that allegedly have exchanges between executives, lobbyists, businessmen talking to the mayor.
Really?
No.
Oh my God.
So. Governor Rauner, thank you for being here. We appreciate you doing the interview.
Well, I look forward to our discussion.
If you break down the numbers, you have a certain percentage of people receiving pensions, but the majority of the people in Illinois are paying for those pensions. Why don't you think that the public perception is more on your side when it comes to this fight? What is the community not understanding about the pension issue? There is an increased number of reported cases of discrimination, abuse, and unequal pay in the temporary workers industry in Illinois. Latino and African-American workers in predominantly blue-collar jobs are the primary victims of this abuse. But a new bill in Illinois aims to better protect those in the growing trade. Greg Mann knows firsthand how hard it is to be a temporary worker in Chicago. The 55-year-old says in 2015 he was working for a temporary staffing agency and was sent to work in a food packaging factory where he didn't receive proper training.
I wasn't given any instructions on what to do. I was just motioned by body language and hand gestures to start working.
Mann claims he worked in dangerously hot conditions and was reprimanded when he couldn't keep up with the workload.
The fumes were so overwhelming, it's like I couldn't breathe. And so I actually got lightheaded, and I told the supervisor that I couldn't breathe.
Mann says after complaining about the working conditions, the temp agency labeled him as a DNR, or do not return, a code often used to identify workers they no longer want to hire. That experience led Mann to volunteer and eventually work for the Chicago Workers Collaborative, a nonprofit fighting for the rights of low-wage workers. Last year, Mann helped open their new center in Englewood on Chicago's South Side. Mann says since the center opened, cases of discrimination against African-American workers have become far too common, and he says agencies prefer to hire Latino workers.
The overwhelming story that I hear from African Americans are the same thing, that they don't get the jobs. The few that are selected to work at these temp agencies or through these host companies that hire these temp agencies are inferior jobs, which are the conditioned jobs that no one else wants to work.
Regardless of who gets the jobs, Mann says some workers are also victims of wage theft.
They've been forced to take a pay card. The money sometimes is not on the card.
Freddie Amador has a similar story. He's worked for temp agencies in Waukegan for more than a decade.
At
times there was wage theft. They would also force me to work overtime, even if I didn't want to. If I said no, they threatened to fire me. I had to work the hours they wanted me to. Otherwise, I would lose my job and wouldn't be able to put food on the table or have a place to live.
Amador believes Latino workers are preferred over African American workers because they are often afraid to speak up about unfair treatment.
Temp agencies prefer to hire Latino workers because they know some are undocumented. Therefore, they are more vulnerable, exploitable, and afraid to complain.
Complaints like these are the reason Illinois House Representative Carol Ammons from Champaign-Urbana has introduced a new workers' rights bill targeting staffing agencies that supply temporary workers to companies, mostly in manufacturing. Ammons says temp agencies employ about 840,000 workers in Illinois, and there is a long list of complaints.
Some of those concerns have ranges from injuries on the job or even sexual harassment in some cases, where the employee feels less safe in reporting some of the violations for fear of losing a job.
The bill, also known as HB 690, includes provisions like staffing firms must give 48 hours notice of schedule changes, no charging employees for the cost of drug testing, transportation to and from job sites must be provided, equal pay and benefits for the same work as direct hires, and proper training.
The temp industry has a good role to play in training people for entry-level work, in helping an employer try out an employee before they offer actual permanent employment, but that's not exactly how it's functioning anymore.
Chicago attorney Chris Williams of the Workers' Law Office is currently representing more than a dozen cases against several staffing agencies in Illinois. He says in addition to shortening hours so workers get less money, staffing agencies use code words for labor.
In my cases personally, there's the feos and guapos. Feos in Spanish means the ugly or dirty, guapos means handsome or pretty. And so guapos is used, surprisingly to me when I learned of it, guapos is used to refer to African Americans, kind of the pretty boys. They don't want to get their hands dirty.
Williams applauds the new bill, which would also address discrimination by requiring temp agencies to provide more information about the workers they hire.
The staffing agencies are not keeping records of who they send, what the race or gender of the people they send for particular jobs. And the companies are saying, well, we just take whoever the staffing agency sends.
The high demand for temporary workers boomed after the 2008 recession. Statistics from the American Staffing Association show nationally 3 million people are employed by temp service firms each month, an increase of almost 30% from 2010. Illinois averages more than 174,000 temporary workers each week. More than a third do light industrial work, common in suburban Chicago factories. Dan Showman, a lobbyist for Staffing Services of Illinois, released this statement. Quote, members of the association are very strongly committed to diversity and following the federal, state, and local laws that ban discrimination in hiring and job assignments, and also the many laws and regulations that prevent retaliation against whistleblowers.
Regulation is not a bad word. You know, if we don't regulate certain things, communities would look differently today, and opportunities for people in those communities would also look different today.
Meanwhile, Mann hopes if Latino and African American temp workers unite, they can have an even bigger voice to improve conditions.
We're fighting for the same thing, a chance to work, to provide for our family, to give good education to our children. So we're not enemies to each other. We're both suffering the abuse of these temp agencies and these companies.
House Bill 690 is expected to be discussed in the House Labor and Commerce Committee next week. 29-year-old Chicagoan Felisa Castro has lupus, a chronic autoimmune disease with no cure.
I first found out I had lupus in 2009. I had lesions that were forming on my face. I didn't know why. I kept going to the doctor and they kept misdiagnosing me.
Castro went into seclusion and says the strong drugs prescribed only made her feel more sick and depressed, so she turned to cannabis for help.
It was definitely an immediate improvement, but it wasn't some like miraculous physical benefit. It wasn't like all of a sudden my lesions were gone and I was cured. It was like all of a sudden I felt better overall, just about my overall condition. I felt like I wanted to eat. Like my stomach felt better.
Castro was one of the first medical cannabis patients in Illinois. She says her condition improved so significantly she decided to open the Healing Clinic on Chicago's North Side to help others learn about the program. To qualify, a patient must have one of 39 conditions, be able to show current medical records, proof of residency, age, have a photo ID, undergo a federal background check, and pay an application fee. There are more than 12 million people living in Illinois, but only about 15,000 patients are registered in the state.
There's a lack of awareness. I think that many patients don't know that the program exists, that medical cannabis is a viable treatment option. I mean, doctors aren't really talking about it.
Dr. Jonathan Spiro is the certifying physician at the Healing Clinic. He says most doctors aren't educated about cannabis, and even he was skeptical at first. But after doing extensive research and working with patients, he's convinced it helps people live more comfortable lives.
It's remarkable how beneficial cannabis can be for so many different conditions. I always like to say that if we'd never discovered medical cannabis or cannabis in general, and someone went into the Amazon and found it, they'd probably get a Nobel Prize for medicine because it's that powerful.
Last year, Governor Rauner expanded the medical cannabis program to include PTSD and terminal illness. Dr. Aaron Weiner, Director of Addiction Services at Linden Oaks Behavioral Health in west suburban Naperville, Illinois, says using cannabis can make some conditions worse, and he was shocked by the move.
If you start smoking cannabis to help with symptoms of PTSD, you're going to still have PTSD, but you're also on the road to developing an addiction. And even in addition to that, what getting intoxicated does is it allows you to avoid your experiences, it allows you to avoid your feelings. And a huge part of therapy for PTSD is connecting with those and resolving those.
Dr. Weiner says there is limited evidence that cannabis helps patients, which is why he believes doctors are hesitant. He sees the program as more of a business opportunity, and he's especially concerned about the marketing towards children.
People are pouncing on it and developing vape pens, for example, that kids can conceal in backpacks, that are making gummy bears, that are making products that are aimed clearly at children, because 90% of addictions start when you're a teenager.
Illinois now has 51 dispensaries and 21 cultivation centers. The state's program remains one of the most regulated in the country. Shay Evans is Director of Patient and Physician Outreach at Modern Cannabis in Chicago's Logan Square neighborhood. She also suffers from lupus and says her life has dramatically changed for the better using cannabis. She applauds the tight security and strict rules.
In other states, patients can go and shop from dispensary to dispensary, whereas in Illinois, you can designate any dispensary that you would like. However, if you'd like to go and purchase from a dispensary, you need to designate to that one. It's just to help tighten down on our dispensing of product to make sure that nobody goes over their limit, and the traditional limit of a patient is 2.5 ounces every 14 days.
The state also makes sure all products are tracked from seed to sale so patients know exactly what they are getting. 2 years ago, when the medical cannabis program began, Illinois State Police increased field training for all officers. That included a series of steps to better recognize what an impaired driver looks like, whether alcohol or drugs are involved.
The final test we're going to do is a one-leg stand test.
1001, 1002.
But the impact of medical cannabis on road safety remains unclear.
Right now, we just have the overall stats of number of DUI arrests in total compared to previous years, and there's no specific data right now that I have to show that there's an increase in marijuana-related DUIs over this year other than prior years.
A recent Gallup poll shows 60% of Americans support the legal use of marijuana. According to a 2016 study conducted by the Paul Simon Public Policy Institute at Southern Illinois University in Carbondale, 4 in 5 Illinois voters support medicinal cannabis, but less than half support legalization for recreational use.
Whether we'll go recreational, people ask me that all the time. I think we're further behind the recreational states.
With limited broad data and scientific evidence, it's more likely Illinois will continue to focus on its medical cannabis program, which expires in 2020. For In the Loop, I'm Lauren Cohn. Chris, the fall happens to be the peak time of year for children diagnosed with concussions. That's attributed mostly to sports being played like football and soccer. And now a new report shows concussion diagnosis for Illinois kids has climbed more than 80%. 12-year-old Yanni Katsogridakis loves sports, but his favorite is football.
I like the contact and the thrill of it, and I like how much action there is on every play.
About 6 weeks ago, the sixth grader who plays with Chicago's Northside Youth Football League took a hard hit during a game.
I was playing fullback, and I ran down the middle and I was going, and I had one guy hit me low, and then two guys hit me high, and my head hit the ground.
Yanni was immediately evaluated by an athletic trainer who determined he had suffered a concussion.
I could not answer the months of the year.
That must have been scary.
Yeah.
The Northside Youth Football League is not required by Illinois law to provide athletic trainers at games. Neither are schools. But in 2011, a state law was passed requiring public high school athletes suspected of having a concussion be pulled from practice in games and not only be evaluated by a licensed healthcare professional, but also be cleared to resume play. That law was expanded this year. However, youth sports organizations are exempt due to the added cost. Mike Lohman, president of Northside Youth Football, says his league is able to afford athletic trainers, and it's made a huge difference in diagnosing concussions.
Years ago, he would have got up, he would have been told, shake it off, toughen up, right? Maybe gotten sent to the sideline for a play, been given some water, and put right back in the game. And as we've learned now from research, that has been one of the major causes of long-term damage from concussions.
That concussion research drew national attention as thousands of pro football players filed lawsuits against the NFL after they were diagnosed with chronic traumatic encephalopathy, a neurodegenerative disease associated with repeated head trauma. Football was put even further under the microscope after the December 2015 release of the movie Concussion, about Dr. Bennett Amalhu, a Nigerian pathologist first to discover CTE in American football players.
The NFL does not want to talk to you. They have to listen to us. This is bigger than they are.
Mike Lohman says today youth football is also safer because spear tackling, where athletes lead with their heads, has been eliminated, and rules against illegal hits are increasingly enforced. But even he admits all sports organizations can do more.
Even though more and more people are aware, it still isn't seeped into our culture of youth sports and high school sports.
Dr. Rebecca Carl treats children with concussions here at Lurie Children's Hospital, where she is a specialist in pediatric sports medicine. She says a new Blue Cross Blue Shield report that shows concussion diagnosis for Illinois kids jumped 83% between 2010 and 2015 is good news, and partly due to awareness.
We are now casting a wider net for diagnosing concussions. Until the early 2000s, we really didn't diagnose concussions unless children had loss of consciousness. We've changed that. The other piece to this is that we have more children involved in sports.
Dr. Carl says the sports medicine community is also keeping kids who suffer concussions in recovery for longer periods of time, making sure they are healed. Lurie Children's Hospital has partnered with many schools and leagues like Northside Youth Football, educating coaches, staff, and trainers about warning signs and symptoms like dizziness, vomiting, dehydration, and pain.
If I had a child who wanted to be a professional football player, I have to say that would worry me. I think that there's data coming out that a high percentage of professional collision sport athletes have neurologic problems. I don't think how that happens exactly is well known, but do I think that we should restrict children at the Pop Warner football level, at the recreational and high school level? No, I don't think we have evidence to say that.
So he rolled a 1, so he...
As a father and also an ER doctor at Lurie Children's Hospital, Dr. Yanni Katsogridakis has always worried about his son playing football.
I'd be very happy if he didn't want to play football, if he chose a different sport as his primary sport, but that's the sport that he really wants to play. So our goal is to make it and see that he's doing it as safely as possible.
I don't think there's much more you can do. You can't make a injury-proof game, so you take the risk when you start playing.
The Illinois Department of Public Health also reports an increase in the number of concussions for children ages 10 to 19 between 2010 and 2015, though its data is limited to hospital visits. And doctors do point out that not all concussions are sports-related. For more on concussion diagnosis and protocols, go to WYCC.org and connect to In the Loop.